Have you ever heard of vitamins that directly help control blood sugar levels? If you are diabetic, pre-diabetic, or simply trying to better understand how to take care of your health, this video could change your routine. Today, we're going to talk about 4 essential vitamins that have been gaining attention among doctors and nutritionists for their benefits in glucose metabolism and in preventing diabetes complications. Often we only think about medication and forget that nutrition, and especially some specific vitamins, can be a powerful ally in glycemic control. Curious? Then stay with me until the end, because besides understanding how these vitamins work, we will always focus on your health and quality of life. 1. Benfotiamine. Benfotiamine is a fat-soluble form of vitamin B1 and has stood out as a true protective shield for those living with diabetes. The main function of this vitamin in the body is to act on glucose metabolism, helping cells to process sugar more efficiently. But what really draws attention is benfotiamine's ability to combat the side effects of excess sugar in the blood. In people with diabetes, chronically elevated glucose levels can cause an accumulation of advanced glycation end products. These compounds damage nerves, blood vessels, and various body tissues. Benfotiamine comes into play precisely at this point. It activates an enzyme called transketolase, which diverts harmful glucose byproducts into safe metabolic pathways, reducing the buildup of these products. Clinical studies have shown that it can reduce the symptoms of diabetic neuropathy, such as burning, tingling, and numbness, especially in the feet and hands. This is extremely relevant, since peripheral neuropathy is one of the most common complications of type 2 diabetes, affecting the quality of life of millions of people. Another important point is that because it is a fat-soluble form of vitamin B1, benfotiamine has greater bioavailability. This means that the body can absorb and use it much more efficiently than the common thiamine found in foods. In practice, it acts faster and more intensely, offering real and noticeable benefits for those who need to keep their blood sugar under control. Besides the effects on nerves and glucose metabolism, it has also been studied for its role in reducing oxidative stress, one of the major villains of diabetes. By neutralizing free radicals, it helps preserve cellular integrity, which is fundamental to avoid inflammation and vascular complications. It can be found in supplement form, usually in capsules of 150 to 300 milligrams per day, depending on the healthcare professional's recommendation. If you are looking for natural ways to protect your body from the damage caused by high sugar levels, this could be one of the best options to consider. 2. Methylcobalamin. Methylcobalamin is an active and highly bioavailable form of vitamin B12, and it plays a fundamental role in the health of those living with diabetes. Unlike cyanocobalamin, which needs to be converted by the body before it can be used, methylcobalamin is ready to act, especially for diabetics who suffer from neurological complications. One of the main problems faced by those with type 2 diabetes is diabetic neuropathy, a condition that affects peripheral nerves, causing pain, burning, tingling, and loss of sensitivity, mainly in the extremities of the body. Methylcobalamin acts directly in the regeneration of nerve tissue and in the maintenance of myelin sheaths, which are the coating of nerves that ensure the correct conduction of electrical signals throughout the body. Additionally, it has an essential function in the metabolism of homocysteine, an amino acid that, at elevated levels, is associated with increased cardiovascular risks. Since diabetes naturally raises this risk, keeping homocysteine under control is an important strategy, and methylcobalamin can help in this regard. Another important benefit of this vitamin is its role in cognitive function and brain health. People with diabetes have a higher predisposition to mild cognitive impairment and even dementia. Supplementation with methylcobalamin can help maintain memory, concentration, and sharper reasoning, acting as a true brain tonic. Vitamin B12 deficiency, in fact, is very common among people who use metformin, one of the most prescribed medications for the treatment of type 2 diabetes. Studies show that continuous use of metformin can significantly reduce the absorption of B12, which makes it even more relevant to consider supplementation with methylcobalamin in these cases. It is available in isolated supplements or in B-type vitamin complexes. The dose can vary, but usually revolves around 1,000 micrograms per day, which can be adjusted according to each person's needs. For diabetics, including methylcobalamin in their routine can be an essential step to prevent neurological damage and continuously protect the nervous system. More than just a vitamin, it represents extra protection to maintain autonomy, balance, and quality of life over the years. If you feel numbness, constant mental fatigue, or have been taking metformin for a long time, often a simple vitamin can make an immense difference in your daily routine. 3. Pyridoxal 5-phosphate. Pyridoxal 5-phosphate is the active form of vitamin B6, and it plays crucial roles in carbohydrate metabolism, nerve health, and even in hormonal regulation. For people with diabetes, this compound can be a powerful tool in preventing complications and promoting a more balanced metabolism. Vitamin B6 is involved in more than 100 enzymatic reactions in the body, and many of them are directly related to glucose processing. Because it is the most bioavailable and immediately usable form of vitamin B6, it ensures that these reactions occur efficiently. One of the main points is its assistance in glycogen metabolism, the storage form of glucose in the liver and muscles. When this metabolism is balanced, the body can maintain more stable sugar levels, especially between meals. Additionally, it is essential for the production of neurotransmitters such as serotonin and dopamine, which influence mood, sleep, and even appetite. Many people with diabetes report episodes of anxiety, insomnia, and binge eating, symptoms that can be alleviated with adequate levels of vitamin B6. Another highlight of this vitamin is its role in protecting the nerves. It acts in preserving neurological functions, helping to prevent and even reduce the symptoms of diabetic neuropathy. This happens because it assists in the formation of the myelin sheath and in the transmission of nerve impulses, which is vital for maintaining sensitivity and motor control. There is also evidence that it may help reduce insulin resistance, one of the main challenges faced by those with type 2 diabetes. Vitamin B6 participates in regulating inflammatory processes and hormonal balance, helping the body respond better to insulin produced naturally or through medication. Generally, it is taken in doses varying between 20 and 50 milligrams per day, but it is always good to consult a professional to adjust the dose according to your needs and health conditions. In food, the vitamin is present in foods such as whole grains, banana, chicken, salmon, and sweet potato. If you are looking for a more balanced routine and want to avoid long-term complications, consider vitamin B6 as part of your strategy. 4. L-methylfolate. L-methylfolate is the active form of vitamin B9, also known as folate, and represents an important advancement when we talk about efficient supplementation, especially for people with diabetes. Unlike synthetic folic acid, which needs to go through several conversions in the body before becoming usable, L-methylfolate is ready to act. And this difference makes all the difference, especially for those who have genetic mutations that hinder this conversion, as is the case for many people with diabetes. L-methylfolate is essential in the synthesis of neurotransmitters such as serotonin and dopamine, which directly affect mood, energy levels, and mental well-being. Additionally, it acts decisively in reducing homocysteine levels, a compound that, when elevated in the blood, increases the risk of cardiovascular diseases, one of the main causes of complications in people with diabetes. One of the greatest silent dangers of diabetes is damage to blood vessels, which can lead to serious problems such as high blood pressure. L-methylfolate helps protect the cardiovascular system by promoting the production of nitric oxide, a gas that dilates vessels and improves circulation. This means more oxygen and nutrients reaching where the body needs them, with less risk of blockages or inflammation. Another highlight is its participation in the methylation process, which is fundamental for cellular health and the balanced functioning of the organism. People with diabetes usually show greater metabolic and oxidative stress, and L-methylfolate can help the body cope better with these challenges, acting as support for internal balance. The deficiency of this form of folate can be associated with persistent fatigue, difficulty concentrating, mild depression, and even a low response to treatment with antidepressants. For those with diabetes, maintaining good levels of L-methylfolate can represent not only physical improvement, but also emotional improvement, something fundamental when it comes to adherence to treatment and quality of life. Its intake can be found in specific supplements, usually in doses of 400 to 800 micrograms per day, which can vary according to need. It can also be found in vitamin complexes aimed at neurological and cardiovascular support. Although foods like dark green vegetables, beans, avocado, and asparagus are natural sources of folate, supplemented L-methylfolate ensures that the body receives exactly the form it can use immediately, which is an advantage, especially for those already living with chronic diseases. All this makes it an excellent choice for diabetics who are looking not only to control blood glucose, but also to avoid the more serious complications that diabetes can bring over the years. So which of these vitamins did you already know? Or better yet, are any of them already part of your routine? If this content helped you in any way, leave your comment below sharing your experience, questions, or suggestions. This not only enriches the exchange with other subscribers, but also helps us create increasingly useful and relevant videos for you. Oh, and of course, do not forget to like the video, share it with someone who also needs this information, and subscribe to the channel if you are not yet subscribed. Every week there is new, practical, and evidence-based content to help you live better with diabetes. See you in the next video.